This is the presentation for Claire Hyde, Heather Borders, Morgan McNeil, and Sheila Norris. Our presentation is on vitamin D and cardiovascular disease. Vitamin D has traditionally been associated with bone health. However, more recent attention has been placed on the relationship between vitamin D and cardiovascular disease.
Almost 1 million people. Today, a new report says you can cut your risk of cancer and heart disease by paying closer attention to a vitamin, vitamin D. Here's ABC's Maro Scalvacampo.
It's a spring ritual, getting reacquainted with the sun, and a critical one, too. The major new study of nearly 1 million people finds the lower your vitamin D levels, the higher your risk for certain diseases, including a 35% increased risk of death from heart disease and a 14% increase in death from cancer. Vitamin D not only helps block a host of major illnesses, it can boost your heart and even strengthen your bones. This while an estimated 2/3 of the population isn't getting enough. So just how do you raise your vitamin D levels? Well, for one thing, spend more time outdoors. Doctors recommend about 1 hour of time in the sun per week, and they say to expose as much skin as possible. Of course, experts say you have to take precautions not to get too much sun, and they point to the vitamin D you can get by eating more salmon, mushrooms, and fortified dairy. For middle-aged and older women, vitamin D3 supplements can help too.
Food sources are really limited, so it's best for most people to take a supplement.
But this spring, experts say the best thing to do is get outside and soak up some sun. Now, that 1 hour of recommended sun time can be spread out over the entire week, and doctors say that amount, just a few minutes each day, generally won't increase your risk of skin cancer, Diane, or other problems that come with too much sun exposure.
And again, you can use some protection.
You absolutely can.
All right, Mara, thank you.
Vitamin D is one of the fat-soluble vitamins and is essential for bone health. We receive vitamin D from certain foods and exposure to sunlight, and occasionally from supplementation. Osteoporosis is a well-known health risk associated with the deficiency of vitamin D, yet new research suggests that the development of cardiovascular disease can also be a health risk as well. Low levels of vitamin D are linked to cardiovascular disease. New research has demonstrated an association between vitamin D deficiency and cardiovascular disease. More recently, in the last 5 years, research has identified positive correlation between vitamin D deficiency and various cardiovascular diseases, including diabetes, cardiomyopathy, hypertension, increased blood lipids, obesity, and even early mortality. The metabolism of vitamin D is related to the renin-angiotensin system regulation and is therefore associated with high blood pressure and vascular hypertrophy. It is also related to inflammation. People deficient in vitamin D are thought to have increased diabetes risk, which could be due to plasma calcium regulation. The same study showed participants with a vitamin D level less than 37.5 were found to have just over 2 times the risk of a heart attack as compared to the participants with a vitamin D level of over 75. Increased TNF-alpha concentrations have been considered a risk factor for congestive heart failure, coronary heart disease, mortality, as well as atherosclerosis. TNF-alpha can also suppress circulating calcitriol concentrations, which is the active form of vitamin D. To prevent the progression of vascular diseases, modulation of vitamin D signaling can be studied for more therapeutic benefits. Supplementation improves survival rates of patients with cardiovascular issues and vitamin D deficiency significantly. The current research is unsure of the optimal dosage, but supplementation is suggested to be between 1,000 and 2,000 international units daily to maintain optimum serum levels. The importance of knowing these findings within dietary practice is important because cardiovascular disease is the leading cause of mortality around the world. Therefore, we need to know what can cause cardiovascular disease, treat and prevent it altogether. Hence, these new research findings address the major health concern and show how vitamin D can be linked to cardiovascular disease. Knowing that cardiovascular disease and vitamin D deficiency and vitamin D toxicity levels can contribute to cardiovascular disease development and is crucial and can help put a stop to this disease from spreading throughout our population. Overall, further research needs to be done in order to address any issues that can arise with treating this disease with vitamin D supplementation and any other possible side effects as well.